Hi, everyone. Welcome to Dr. Lisa Sulsenti podcast. I am Dr. Lisa, and today we're going to continue on our part 2 of how to help reflux and GERD in a functional medicine manner. Okay, in the first podcast, if you didn't listen to it, in the first part of this, part 1, I talked about how the digestive tract works because I want you to understand how it's supposed to work, what the players are, and what's supposed to happen. And that gives you a really good idea of if your digestive tract is working properly, right? So once you understand that, then you can go into what is broken, what's not working right, and why. So the difference between the medical approach to this and the functional medical approach is not that one's better than the other, but I just want you to understand like where I come from versus they are. They love to, or they're trained to treat the symptoms. So if the symptom is a reflux, right, of acid coming up your esophagus, like coming up your throat, or if you're having pain when you're eating and pain while you're after you eat, before you eat, the heartburn, the digestion, the burning in the chest, the bloating, the sour taste in the mouth. If you have been scoped and they see cellular change, in the esophagus, Barrett's esophagus, if they see this stuff that's not good, they're going to treat that acid problem. They're going to get the body to stop producing the acid so you don't have the pain, but of course you don't have the cell problems, the destruction of the tissues. And rightfully so, I understand it. But what I have done with many, many, many patients over the years is we get the body to produce the acid. We get the body to get this under control, and we've reversed things as severe as Barrett's esophagus, which is having precancerous cellular changes of the esophagus. We've gotten rid of GERD and reflux and ulcers and things like that. I've had people go and get scopes and they've had polyps in their stomach. I just recently have someone that has, I think, almost about 100. That is nothing I've ever seen in my life. And ironically, her medical doctor told her that these numerous amount, I'm not even kidding you, she thought she had 35. Then when they went in, they were like, we think it's 60. And then they went in and it was like at 100. And her medical doctor told her it was because a side effect of one of the antacids, the PPI she was on. So this is crazy, right? Her esophagus looked great. The medicine really cleared up the Barrett's, but she wound up getting 100 polyps or 60, 80. It just kept going up every time they went in. So she was really upset because she's like, it helped in one way and it worked in the manner it was supposed to, but it caused a problem somewhere else. So this is the things that people struggle with. These are real struggles. And I want you to go back to the first part 1 and understand how the stomach worked. It starts with the chewing and the saliva. We talked about that. We talked about the enzymes in the microbiome and what's really important. We talked about the teeth, the things that can kind of go wrong in the mouth. We want to keep that healthy. Things I want to address right there for you is things like the wrong toothpaste. If you have bad breath and you're constantly trying to get rid of bad breath with maybe mouthwash and things like that, you can easily strip that pH and that microbiome of the mouth. So if we start right there and that's a problem, if you don't make enough of saliva, if the microbiome's not right, if you have gingivitis, if you're having problems with the mouth itself, dry mouth, the bad breath, you want to start right there. And you want to really look at switching your toothpaste to healthy toothpaste. You want to make sure that you have more like coconut oil for coconut pulling. You take coconut oil and you put it in the mouth. Look up pulling with coconut oil. Look that up. That's a really better way than using mouthwash and things like hydrogen peroxide and things to strip the mouth. Definitely check your toothpaste. The one that we use, I wanted to share with you, is there's one called Biocidin toothpaste, which has a lot of herbs. There's also one, Aura Wellness. There's a tooth powder. There's one with essential oils. You can look that up. So the toothpaste is really important because you could be stripping the microbiome and you can definitely changing the pH of the mouth. You want to make sure that your mouthwash is good also. Check the oil pulling. So I said that. And the other thing for the mouth was the bacteria is super, super important. So what foods you eat will really help with that. So eating like your plants that have the prebiotics in there, your plants, your fruits and your vegetables, they are loaded with the prebiotics, your seeds, your nuts. Those are really, really good for the mouth. So that's really important. And when we get into this, you're going to understand the diet is really crucial for GERD. If you have GERD, you have to look at your diet. You really have to be very critical here and be honest. Because if you're eating those boxed foods, I'm telling you, when you go to the food store, the best, Dr. Lisa's food store doesn't have box aisles. I get rid of all of them. And I might have a little tiny section for condiments or something like that where we get a little lazy and don't want to make our own. And I don't mean lazy in a bad way, because I'm like that. I'll just go buy organic ketchup instead of making my own. Okay. But not still a healthy thing. But Dr. Lisa's market is going to be more of a farmer type market. That's my food store where everything's fresh, and you're going to want to get your prebiotics and your plants and your vegetables, and you want to be able to chew. So that was the next thing. Make sure that you're chewing your food, you're chewing slowly, and you're really chewing it. You're not just gobbling it down. So when we get to the stomach, the second thing we talked about is super important, is to have that pH. So the pH of the stomach is really critical here. Go back to that first part and understand why and how that works. I want to talk about the complications here that goes on here. So we get excess gastric fluid because the food starts rotting in there. And that's that fluid, that's that acid that you feel. It's like organic acids and natural acids in foods that kind of get up there. It is not the body having too much HCl, because what actually happens is the stomach cells actually shut off and don't produce it. The problem going on in the stomach here isn't necessarily too much acid. It's actually not enough acid, and the body's going to work hard to try to produce it. It's going to have this putrefaction of food going on. It's a pH problem. The stomach becomes a higher pH, and we usually, when we get to 6 and 7, we definitely have problems. Now, the number one way the body gets to this bad pH in the stomach is what you're eating. So I need you to really be honest and start cutting out processed foods, refined foods, fake foods, food additives, food dyes. I want you to turn the boxes over and really start Googling the ingredients and really start doing this for yourself. Because the fact if you're on antacids and Tums and PPIs, you really have a serious problem. And this really leads to other issues. It's connected. And so you want to make sure you get your stomach to produce HCl and pepsin and pepsinogen. We want to make sure the bile is being produced and the pancreas is producing enzymes as well. We want this to work. We don't want to shut this down. And what we have to do sometimes in medicine is give you these serious drugs that shuts it all off, because your body, when it gets shut off, it sometimes has a really hard time doing it. And that's my goal, is to get the body to be able to do it. It can do it. It can do it. So the first thing to do is look at what you're eating. Please be critical there. Another thing you can do is something called bitters. And this really works beautifully with my patients. Look them up. Look up bitters. I particularly like the ones that are more like an herbal base. You'll see them. What they do is they stimulate those parietal cells. So again, those stomach cells, they're going to stimulate them to produce the acid that you need. What's going on in your stomach is because there's a low pH. I mean, the pH is not low. It should be. You're getting a high pH. You're getting less acid produced, and you're getting less pepsin and all the things that you need to digest food. So your food's it's not getting digested, it's getting rancid. So what the bitters are going to do is the opposite. It's going to stimulate the parietal cells to make the acid called HCl. It helps tone and support that sphincter at the top that we talked about in part 1 that can get messed up. It's going to increase HCl, increase natural stomach acids, gastric acids, pepsin, pancreatic enzymes. It also is actually pretty good for brain, lungs, kidneys, prostates. It increases bile production, and it will actually act with helping with lowering blood sugar. So you can't just get off a PPI. You kind of have to titrate that and do that small and do that with your doctor. But bitters is a really good place to start doing that. And you can drink them, you can take supplements with them, and you can look that up. Lemon water is another thing to help activate the liver. It's the number one support of a liver detoxification. This is actually really important. We want that liver to work properly. So this is a huge thing that I do with people is we get the liver to work properly because this is really important. And when you're not digesting food, you're becoming toxic and this gets backed up. So this is really important. So when you're thinking GERD, you're thinking the patient has a high pH in the stomach and probably no HCl. So I'm thinking low acid, high pH, inflamed stomach, and a lot of organic and gastric juice from the putrefaction of the food. So this is where I am. And this is when we think ulcers could be a problem. So we have to go through that together. Holy basil is something that really helps here as well. You want to chew your food, definitely do some drinks and bitters, clean up your diet 100%. You're going to have to work on that. We would have to look at the gallbladder and the liver and make sure it's working properly. The other thing to do that's super important is to look at your gut. And you might say, well, what's that got to do with it? Because the gut's after it. Like, this all comes first. Because the gut is super important at what goes on at the top. It's like the fire underneath it. And some people might disagree with me, but I've been doing this for so long that a lot of the times we help patients. We support them with a few herbs and a few things like digestive enzymes. We'll do the holy basil. We'll do the bitters. But we'll go right to the gut, the colon, and we'll go in there and we'll look at food sensitivities. So this is a really big thing. That's something, if you're going to do one type of testing, I would consider or recommend you doing that. A food sensitivity test, you want a really good company as well, and making sure that it's super efficient company. And if you're going to get your blood drawn, you might as well do as many foods as you can, because some of the online quick ones are just, they're not as robust as you could get for your money. So the food sensitivity test, why is that important here? Because what we do in our practice, or my practice, is we look at what foods the body's attacking, what can cause inflammation in the digestive tract. So although it's after the fact, like as your food goes through, it creates the fire or the tornado in there. And I am sharing this with you clinically because in my practice, when we put the fire out in the gut, the stomach seems to follow suit. We also get the patient to eat a wholesome, whole food diet, and we support the pH and the systems in the stomach to start doing it themselves. So that's how we do this. So I'm breaking this down for you. This is not just taking bitters and doing holy basil and being like, okay, I did it. You can't get in the mindset. And I do warn myself this sometimes when I get down this road, and I warn other nutritionists and functional medicine. We don't want to act like medicine. We're not there to just treat the acid burning them, right? The gastric fluids. It's not HCl. We don't want to just give them HCl as well. We don't want to just give them stuff and do it for them. What our goal in functional medicine is to get this stomach to do exactly what I told you in part one, how it's supposed to work. We want that to work. We want those systems to work. The way we do that is multi-steps. This is a severe thing when you start getting cellular damage, when you're like precancerous, or my patient was like 100 polyps in her stomach. This is serious. So we're just not going to treat it with just like lemon water, correct? So what we're going to have to do is we're going to have to look at the whole digestive tract as a whole. The first thing I do personally, or professionally, I should say, if it were me, I've done this personally because I've had reflux, is you're going to do a food sensitivity test, and you're going to find out which foods your body's attacking. Your immune system in your gut cells, which foods are they attacking, and you're going to remove them because you're going to take out that fire. You're going to take out that inflammation, one of the causes. And you're going to do that. The second step is to do a stool microbiome test. Now, we don't have one for the mouth yet, and my company is working on that. But for the time being, or not for the time being, because what I would do is add the mouth microbiome to the gut microbiome. But right now, I only have gut microbiome. So you're going to go to the gut microbiome, and you're going to do a stool test. And ours is the most thorough out there because I keep looking and comparing. It's 50-something pages long, and the information it's going to give me is, yes, it's going to be the top of the digestive tract. It's going to tell me, is the pancreas working? Is the bile doing its job? Is the liver, is the gallbladder doing its job? If they don't have a gallbladder, is the bile still getting in there at the right time? Are the enzymes there? It's going to talk about, are they breaking down their vegetables? Are they breaking down their meat? Is this stuff still being putrefied? And I can see it right there of what's going on. The next part is to look at the gut microbiome, which is all the good bacteria in the gut. And you need this for healthy digestion. It all goes together. You need this. So we want to make sure that that is healthy. If there's a certain family or species overgrowing, you have an overgrowth in the small intestine or an overgrowth in the large intestine, we need to fix that. Because again, what's going to happen is toxins will start building up. The two important parts of the story is the liver and the gut. The liver has a detoxification system and the gut has a detoxification system. If they don't work properly, we're going to get the wrong pH and we're going to get a ton of toxins in the body. It's stuff's like a plumbing. It backs up. It just backs up. So a lot of times what we see is when a patient has a stomach not working properly and the pancreas not really doing its job, the liver is sluggish, the gut isn't working properly. Do you understand? This is like a plumbing problem. So we're going to get in there and fix this and make this a really healthy digestive tract. So food sensitivities, and then you want the stool test. The other half of the stool test, once we find out your microbiome imbalance, we match it with the right probiotic. Super key to get the right probiotic in the digestive tract. Just as important as the bitters and the other things we talked about, we definitely want that right probiotic in there. It's super, super important. It's life-changing. It's really I tell everyone, if you're going to do anything, that's what you want to do. You don't want to just go to the store and pick a random one. You want to pick one that matches your gut imbalance. The other half you need to know, because these can cause GERD, these can cause leaky gut, these can cause the fire in the gut. They can cause inflammation, parasites, yeast, bacterias, viruses, biofilms, all these little, I call them pests in the garden, right? I always talk about the garden and how your gut, your microbiome is the terrain, it's the soil in the garden. And you want to make sure that they're not in there. So, because if they're in there, same with heavy metals, because they feed off heavy metals. So if you've got a lot of this toxic stuff in there, do you see where the pH of your digestive tract isn't going to be well? So you have to think about, yes, the mouth, the saliva, the chewing, what's going on with your teeth, the dentistry, the infections, what's your hygiene on your mouth. But you also want to look at your diet. Are you eating crap? If you're eating absolute crap, you're eating foods at like pHs of 6 and 7s. So all of that's important. What's going in at the top? What's going in your mouth? But then we get down to the stomach, and that's like the middle of the road. We're like, all right, this is suffering because of what's going on at the top and then what's going down below, the fire below. So yes, we're going to support that stomach, get that stomach pH better, help that stomach to do what it's supposed to do. But we got to look below. What's on fire below? If you've got parasites, you're probably going to get reflux. So that's what I've seen in my practice, is that I sometimes go, you know what, I'm not going hard at this stomach at the moment. I'm going to give you some things to help support the systems, to help report the stomach cells and all of that. But what I want to do is I want to get this gut fixed. So that's really important. And these are the things that I'm recommending for you. Now, what I want to leave you with, and I don't want to go off crazy at bashing PPIs, because I do feel like they help in an emergency scenario. And so I'm not here to argue that, but I am here to give you an educational information about other things you can do. So apple cider vinegar helps lower the pH. The bitters help the stomach cells produce acid. So those are two things we tend to do. The digestive enzymes help the pancreas give you enzymes. A lot of the testing I do, I can see which the patients need instead of putting them on all this stuff, because I'm not a big supplement person, right? We don't want to just treat symptoms. That's not what we're doing. We're trying to get to the root cause. But these three things help. The apple cider vinegar, the digestive enzymes, and the bitter. I also love aloe juice, because it really soothes the actual cells. So if you burnt your skin or you cut your skin, you could put aloe on it. So think of the skin inside. Think of the skin that's inside the esophagus, it's in the stomach. My patient that has the Barrett's, my patients that have, the ton of polyps, get the aloe juice in there to help soothe that, fix that. We also talked a little bit about the holy basil. That's an herb that you can do. And then getting into my protocol, which is food sensitivities and finding the right probiotic to your gut microbiome, and then making sure that there's no pests in there. So those are 3 really important things. Okay, like is there H. pylori in there? That's another common cause. What is that gut flora doing? So figure it out instead of just guessing and going into the health food store and buying all this stuff and hoping. Antacids is what I wanted to go in and end with. Again, I'm not here to bash it. I just want to give you some information. Antacids, they cause leaky gut. They can make these things worse. Asthma, dementia, cancer, diabetes, leaky gut, osteoporosis, irritable bowel, Crohn's, celiac, calcium. It can lower it. It can actually cause the osteoporosis and stuff like that. And I have done this for 10 years, over 10 years now, and I've had patients that will say, I've been on 2 bottles of Tums before I met you. I was downing. I didn't want to tell you. Or I was on a bottle of Tums, and they were going, and I don't mean to bash Tums, but they were taking over-the-counter acids at crazy levels. And after they worked with me, they're off all that stuff. Same with PPIs and things like that. So they do have side effects. Blocking acid blockers, which are H2RA drugs, they actually go for the histamine receptor. So they're blocking this histamine acid production in the parietal stomach cells. So they'll use this for reflux at night, peptic ulcers, they Pepsic, Zantac, all these drugs that they use. And what happens is it really should only be used short term. So you shouldn't be on these long term. If you're finding yourself on these things long term, you really got to get to the root cause of this. What concerns me about protein pump inhibitors is they can block the actual production of these parietal cells. They'll shut them off. It doesn't really block the histamine receptors, and you might still be clearing your throat. You might still be having some symptoms, and you're like, I don't really know why this isn't working. But the acid might be calmer, and the cells might be getting better. So the PPIs is not that we're against them, but these aren't things that you really want to be on long term because they can create other problems later. They have, they can lead to gastric polyps, gastric cancer, colon cancer, things like that. And it's funny because we're very compartmentalized, right? How could you take a PPI and have colon cancer? Right? If you're shutting off the acid stomach, if you're shutting off the parietal cells in the stomach, how are you getting colon cancer? So it's because it's all connected, and that is exactly why we fix the gut, we fix the colon, and we see the stomach clear up. I talked about lemon water really helps the liver with the detoxification. We talked about apple cider vinegar. Look at my little list that we went through. I think we went through everything. I think we nailed it. So yeah, we did. We got through everything. Oh, yay. So let's just summarize it so you have an idea. I am not here again to treat anything or replace your medical care or your care with your health care practitioner. This is for educational purposes. So if you feel like you're taking too many antacids, you're kind of treating this yourself, you don't really know what's going on, consider reaching out to me and we could see what your gut is doing, what the fire inside you looks like, and we can work on this system. If you're on PPIs, we would work with your doctor. I would never take you off it and treat you alone, but we would discuss these topics. And again, when I do my testing, it's a very thorough testing. We're looking you at as a whole person. We're not just looking at one area. So I hope that helps you, and I hope you found this one quite interesting because I did. When I learned it years ago, I just want to tell you, I'm sorry I went over the 20-minute mark, but I wanted to share as much as I could with you. When I was in class, and my husband's a chiropractor, and he was sitting next to me, and we were learning reflux, and they were like, it's not an acid problem, it's a pH problem. And I was like, huh. And they're like, but your body got too much acid in there because of the putrefaction and the gastric fluid that's in there. And so he said, take apple cider vinegar. And I immediately went to chemistry class and I was like, why would you put an acid into an acid? Like, it's an acidic environment. And, I raised my hand not thinking about it. I was just kind of like, well, if the body's producing too much acid, why would you put an acid in there? And I raised my hand. And he was like, and my husband was like, oh my gosh, I can't believe you asked that. And, but I was just thinking basic chemistry. Why wouldn't you put a base in there, right? Calm down an acid. And I was just thinking and quickly raised my hand. And he loved the question. I'm sure a lot of people ask that question. So he basically explained that it was a pH problem. And so a lack of HCl. So getting in that acid really helps. So something like the apple cider vinegar really helps you to get the pH right? I'm spacing for the word that I was thinking of doing the bitters helps the parietal cells produce the acids. So the ones that you need, the HCl, the pepsin, the pepsinogen, and the HCl. So I was going in, the first time I sat down, I'm in school, and I just thought, well, if you have too much acid and you're just producing too much acid, why would you put an acid in there? And he smiled because he knew where the answer was to that. So these are things we learn, and these are the things I love to share. So I hope you enjoyed this again, and I'll see you at the next one. Take care.